This is a fabulous question. So the question is, why are insurance companies paying these ridiculous prices that are set by the hospital, and why aren't they trying harder to negotiate those prices down to something that's realistic? Let me explain. So in 2010, the government enacted the Affordable Care Act. And with this act, they were really trying to rein these big insurance companies in. In fact, they made a provision of the Affordable Care Act called the medical loss ratio. The government basically said, hey, insurance companies, we are getting real freaking tired of you collecting so much money from us every single month and then putting it straight into your pocket as profit. So to combat that, we are going to enact a rule that says that you have to spend 80% of what you collect from people on actual medical care, and then you can keep the other 20% for you. This obviously backfired on them because think about it. If your mommy sent you to the store with her credit card and she said, sweetie, I want you to buy all my groceries, and then whatever the total of the bill is, you can keep 20%. Given the rules that your mom just gave you, are you more incentivized to buy all the most affordable groceries, find all the coupons, all the best deals, and then keep 20% of that? Or are you more incentivized to buy all the most expensive groceries and then keep 20% of that? You're going to want to spend more so that you can make more. Now, insurance companies still need to be able to show their members that they're saving them money. Otherwise, what's the point in having insurance? So what they'll do is they'll negotiate a discount. And what that can look like is maybe a hospital charges $500 for a Tylenol. And then the insurance company comes back and adjusts that rate down to $200. And then they can look at their members and say, hey, look how much money I saved you. When in reality, the actual cost of that item is much, much less. And last, if insurance companies are incentivized to spend more money in order to make more money, then why do they keep denying us care? Well, they do want to spend more money, but they want to spend it where it benefits them the most. Health insurance companies in the United States have become so massive that they've been able to buy up multiple pieces of our healthcare system. So insurance companies now own their own hospitals, their own pharmacies, their own clinics. Pretty much every single piece of our healthcare they have a hand in. So even though insurance companies are incentivized to spend more money, they are even more incentivized to spend that money in places that directly benefit them and steer patients away from services that are technically now their competitors.